Thank you for taking time to view the BADBIR Updates presentation. I will be giving you a really quick update on the study and any recent changes. These are the topics I will cover. Firstly, a recruitment update. As of the start of August 2019, there's been a total recruitment to BADBIR of 18,464 patients. Next, the eligibility criteria. The most important update is that for adults, as of the 31st of July 2019, we are no longer recruiting to Humira and Stelara, and there has been a pause in recruitment for Otezla. This is not the case for patients under 16, who we will continue to recruit to all systemic therapy. You can check our current drug list on our website, www.badbir.org, on the eligibility page, or you can call the office. A few things to note about the eligibility criteria. Conventional patients must have a PASI of 10 or above and a DLQI of 11 or above, unless they are switching between treatments. Patients will be considered a switcher if they stop one conventional and start another with less than a 3-month gap. There is no PASI or DLQI score requirement for biologic or small molecule patients, but the scores are still required. Conventional and small molecule patients must be naive to biologic therapy, and if a patient is switching to a biosimilar, e.g. Humira to Amjevita, they can be recruited to BADBIR at this point. The HADS questionnaire. We now request that all patients complete a HADS questionnaire from baseline to follow-up 6. The questionnaire was approved for use in last year's Study Amendment 11, and we now have the final permission from the licence holder to use the HADS questionnaire. If the HADS questionnaire was missed for a patient, please remember to select No to the question, was a HADS questionnaire completed, to avoid data queries. You will no longer be able to print patient questionnaires from the website due to our licensing agreement. You will need to log on into the database in order to print these questionnaires. Current therapy. It is very important to document changes in therapy via the database at follow-up. The drug the patient is receiving at the time of an adverse event determines which company it is reported to. If patients are switching to a biosimilar due to a trust-led procurement policy, please record the stop reason as financial consideration. We have now stopped recruitment to Humira and Stelara, but these patients will still be followed up as normal if they are currently in the biologic cohort. We will not switch the patient if they are currently in the conventional or small molecule cohort. Stelara and Humira recruits must be added to the database as soon as possible. There will be a cut-off date when we will no longer accept entry to the database. Follow-ups. The dates that the BADBIR generates for follow-ups acts as a guide. We would not expect you to arrange the patient's clinic appointments around these dates. If a patient is not attending clinic, you can notify us via the patient's feedback, and this will remove their follow-up from the overdue list. If several missed follow-ups are required for a patient, it could be possible to enter all information in the latest follow-up and mark all the others as missed to save time. Please make sure follow-ups are a priority to keep the amount of overdue follow-ups to a minimum. We have had a change in the adverse event data entry. We have changed the way we collect adverse event descriptions on the BADBIR database. In order to obtain a more accurate picture of the event, we have split the description into 3 separate boxes: symptoms, diagnosis, and treatment. If certain details are not available, please state this in the corresponding text box. The short description box will be visible for a short period, but disabled for any data entry. As well as completing the treatment section, please also enter any systemic medication in the concomitant therapy section. Going on to the database demonstration. So the questionnaires are now located when you log on to the database. Go to this tab, and here you can download the relevant questionnaire. When entering a new patient, please enter the PASI and the DLQI prior to commencing treatment. We often have the DLQI entered at the time that the consent form was completed, but we would prefer to have the DLQI entered here with the answers from before they started the treatment. Obviously, with the DLQI, you can enter a number of with the PASIs, you can enter a number of PASIs. So there's been a new function added onto the database for the Stelara dose dates. So if the patient's continuing on Stelara, you click that there's been no changes and then select Edit, and you'll come to this page. So now it asks the question, do you know the dates of each dose during this follow-up period? So I don't know the doses, I don't know the dates, but I do know that the patient followed the schedule. So I click here. And then the database will suggest dose dates which are in line with the dosing schedule. So now I can just add these suggested doses, and they will become here. I can edit these. If the patient was switching from Stelara to a biosimilar, I'd enter the Stelara stop date here, and then here I would click financial consideration if the patient is switching to a biosimilar due to a trust-led procurement policy. Next, having a look at the adverse events section. We often have pregnancies and skin cancers entered as non-serious, but these have to be entered as a serious adverse event. So to enter a skin cancer, I'd click yes here, add new event, symptom, so yes to serious adverse event, and then it's a medically important event. Patient wasn't hospitalised overnight and now has been resolved. Save page. Looking at the HADS questionnaire, if the patient didn't complete the HADS questionnaire at this visit, please select No and save page. HAT questionnaire, No, save page. And then you'll get taken to the preview queries section.